Rice Lake Weighing Systems carries several models of pediatric scales for all infant and baby weighing needs. Options include digital scales equipped with motion trap movement compensation technology and classic mechanical scales. Motion trap technology provides a steady, accurate weight reading for even the most active babies. A built-in measuring tape is also incorporated in all models for added convenience. Proper scale care and cleaning is essential to ensure a long life of effective operation. Baby scales are typically easy to clean with a removable tray to simplify the cleaning process. Before cleaning, always disconnect the scale from its power source. Use a damp cloth or tissue to clean all external surfaces. Mild soap and water may be used, however, isopropyl alcohol should not be used as it may damage the display surface. Dry with a clean, soft cloth and perform a quick inspection to see if any cracks or other problems can be detected. Inform the clinical engineering department if any issues are detected so they can assess the product and determine any actions that need to be taken. Parts can and should be replaced when needed. All Rice Lake and most other digital medical scales feature units of measure locking, which prevents the operator from unknowingly switching the scale between kilograms and pounds or vice versa. This essential safety feature helps prevent dosing errors due to calculations based on incorrect units of measure. Front panel display keys include tare and recall. Tare is used to subtract the weight of additional items, such as a pad or blanket, from the scale to pinpoint only the weight of the patient. Recall displays the last weight measurement. This enables a baby to be placed on the scale, quickly removed, and then have its weight recalled for charting. Make sure the scale is placed on a sturdy, level surface. The scale should not be placed beneath heating or cooling vents or areas with environmental vibration. A child should never be left unattended on a scale. Be sure to use the proper scale for the age and weight of the child. Never place an infant on a stand-on scale or other scale not designed for infants. When appropriate, use a four-sided cradle design for the smallest, most vulnerable patients. Avoid touching the baby or infant while the weight is being captured, as additional pressure on the scale will influence the weighment's accuracy. If the patient has oxygen lines or other monitoring equipment, support the lines with one hand and press the reweigh key to obtain the most accurate weight. Rice Lake Weighing System sets a high standard in medical weighing equipment. The combination of efficiency, safety, and scale features with the added value of 70-plus years of weighing technology leadership makes the company the industry's leading choice. From hospitals to clinics and health clubs, any health or fitness environment can utilize Rice Lake's proven scale technology, all with legendary service and support.